everyone, I am Dr. Divya Bajpai. I am Associate Professor at KGS Medical College in KM Hospital, Mumbai, India. And I am also the social media team member for ISN Con 2022. And as you know, we are holding a series of very interesting interviews with the esteemed faculty of ISN Con 2022. And today, here I have someone very special. He is Dr. Vivekanand. He needs no introduction. He was the past president of ISN and he now heads the George Institute in India. So sir, without much ado, I welcome you to this faculty interview series. And I would like to ask you that we have seen you wearing lots of hats throughout your illustrious career in nephrology. You have been an advocate, you have been an educator, a researcher. What drives your passion till date in nephrology? How you keep on going with so much work daily?
Well, first of all, thank you, Divya, for inviting me to have this session. And I would like to congratulate you and the other members of the ISN social media team for spreading the message of kidney health to everyone. We hope that the message reaches everyone who is in a position to make a difference, to everyone who has kidney disease or is at risk of developing kidney disease. And that in fact is a segue to the answer to your first question that you had is you said nephrology. So first of all, I don't see myself only as a kidney doctor. I see myself who has interest in human health, and using my position as a kidney doctor, I would like to study more, improve my knowledge, and using that perhaps contribute in whatever way possible to improve the delivery of healthcare to humanity, especially those who are vulnerable, who do not have access to the best quality healthcare that many of us take for granted and thereby are disenfranchised. I also have been fortunate during my career to meet with people who have a range of expertise which I have lacked, and I have tried to learn from them and imbibe some of their knowledge, but also realize during the course of all these years that it is not possible for me to become an expert in everything. So how to use the skills that I have acquired to engage with them in an effective and efficient manner so that they also feel motivated to contribute to the quest that we share and thereby lead to improvement in human health. Now, since you mentioned nephrology, let me say that I have also seen kidney health as or study of kidney health as being closest to maybe as holistic a position to human health, as you can find in other medical specialties, where one tends to have a relatively narrow focus and looks at an organ rather than an overall human being. The basic thought and motivation behind most of what I do is to really improve my understanding of human health, as I said before. And it is not necessarily to achieve one specific goal. And this often has taken me in different directions. As you said, I have done more than the number of things that usual person does. You said hat. I don't wear a hat, but then of course I admit that I have done many things, including setting up a basic science research lab, being involved in many professional societies. I've been fortunate enough to have interacted with a range of individuals, young and small. But I would say the biggest gift that I have had is to have the opportunity to work in a place like PGI, where almost every day you encounter excellence in the corridors, and that excellence is not just in the gray beards and gray haired people, but the youngest people who roam the corridors, who come to institutions. And that is true for, I would say, most medical institutions, that the young people who come, they are curious, they are hugely knowledgeable, and it is up to us to give them the platform that they need to expand their own skill set and contribute to the overall growth of knowledge in the institutions that they find themselves in at that particular point of time. So I think that's really what works for me at this point. And interestingly, I have continued to find new things, and every few years there is something else that becomes apparent because science continues to make progress, and it is important for us to stay abreast of that and not limit oneself narrowly. So one of the things that I would say is that I have tried to not narrow my focus but stay as broad as possible in terms of my understanding of human health. And that goes to the point of expanding beyond just medical specialties to interact with people who study the broader determinants of health, including social determinants of health, economics, trying to understand how policy making works, how we can interact in a more effective way with policy makers. You use the word advocacy as well, so advocacy is also useful. But I would say that my goal, or our goal, the goal of the team that I work with, is to not becoming activists, but advocate using evidence, using data, and coming up with solutions that can be appealing to all the stakeholders with whom we do advocacy, which includes government, civil society, other professional organizations, etc.
That's really interesting, sir. Actually, like seeing you, what take home I take is that you get opportunities and how you make the best out of it. Like you turn everything into gold, whatever you work on. And the way you said, you have this very holistic approach and you are not fixed to one particular thing. That's very inspiring, sir. So, moving ahead, you are speaking on a very intriguing topic at ISN Con, and that is on implementation research. Not many of us are, including me, were even well aware of what that topic is before we heard your talk. So tell us something about that. People are really interested in knowing that.
Right, thanks. And that goes back to the point that you made a few moments ago, that I have not been afraid to walk through any open door that I see. The worst that I think will happen is that I will have to come back through that open door. But many of these open doors lead to new possibilities, and my involvement in implementation science, implementation research has been as a result of my walking through one such door. And implementation research has been most of what I have done over the last 10 years or so. About 10-15 years ago, my understanding of implementation research was rudimentary. I understood as I became a little more senior in my work at PGI, and I saw that most of what we were doing was very narrowly focused and potentially benefited only the people who came to us, but was not having a wider influence on the society, and we were making really small dents. And that took me to thinking more about it and interacting with people who do this in a more holistic manner. And I came to the George Institute, which is where I work currently, which has a program of implementation research, and that has developed over the last 10 years. As I said, the focus of or the goal of implementation research is really to make sure that whatever interventions or approaches that have been shown to be effective and safe in randomized clinical trials and other such experiments are able to reach the people who can potentially benefit from them. And as I said during my talk, is that in theory, everything seems really perfect. But when it comes to practice, then we realize the gap between what is possible in theory and what actually happens in practice. And there are many examples of that. To be honest, and just to put this in context, this is not only relevant to India, but this is relevant to healthcare delivery anywhere in the world, right? That the people are not necessarily getting the benefit of human knowledge that has been generated over the course of last several decades. And the implementation research is a way to find out how can we bridge that gap. The biggest feature of implementation research is that it has to be multidisciplinary or transdisciplinary. We have to engage with as many stakeholders as possible. Whoever has either any bearing on delivery of the intervention, but also to think equally importantly of the people who will benefit potentially from that intervention. In our day-to-day clinical practice, the patient is thought of as a recipient of advice. But when you think of implementation, it's really important to take the patient's perspective into consideration, the societal perspective into consideration, the perspective of the healthcare delivery system in which we are working into consideration, because only then will we be able to derive scalable, sustainable, and affordable approaches to deliver healthcare interventions. Discoveries are being made on a day-to-day basis, and last few years have been really golden years for patients with kidney disease because a number of new therapies have been shown to be effective, which increases our challenge further because we may think that we are doing well by just prescribing these treatments to those patients who come to our clinics, right? But that's only a very small proportion of the individuals who can potentially benefit from such therapy. So that is why we have to think of scale. How can you implement whatever you want to do at scale? How much does it cost? What are the potential barriers? What are the potential facilitators? If something works, why does it work? If something does not work, why does it not work? These are the various elements that we need to think about. Now, unfortunately, most of us during our traditional medical education are not exposed to this thought process or actually implementation of at this scale. It is important now that we change that and we introduce implementation science and implementation research in our education, in our discussions, into our scientific sessions of meetings. So I would actually urge that we have a strong focus on implementation research in many of our meetings and go beyond just talking about education to making it happen.
That's completely true. Actually, while listening to your talk at ISN Con, I was also thinking that this kind of research is something which is very, very feasible to do in our own small setup. Like we might or might not be able to do cutting edge, exotic RCTs, but these are small things which we can definitely do, and it will definitely make a difference of how care is delivered to our patients. So I think after your talk, like you have set the ball rolling, and it will be taken ahead by many of those who are attending ISN Con. So sir, I have a last question for you, and that is as your capacity of past president ISN. So in that capacity, what is your advice to young nephrologists, especially from India, who are attending this conference? What do you think will be the best thing they can do once they pass out from nephrology, and how they should take their career ahead?
Thanks, Divya, for that question. But before I come to that, I would say just to your point about many people starting to think and do implementation research, I would caution everyone to do it the right way, because implementation research also has its methodology, which we should find out more about, learn more about, and then use in an appropriate way. Only then we will get the kind of results that are potentially useful to the broader community and are broadly generalizable. So that's something which I would like to caution everyone, that it's not like we hear about a talk on implementation science and the following day we will all start doing implementation research. It doesn't happen that way.
Yes.
But having said that, I think coming to your question, my advice, and this comes from my life experience, is, and this doesn't have to start at any stage, whether you are young or old, it can be, you can start any time, is the first thing I would say is that you should be curious. You should always want to. So the purpose of education for me is not to learn facts, but it is to learn how the universe works, how health works, how human body works, etc. If you take that approach, perhaps you will find more joy in your learning and be able to find questions that make more sense to everyone. And to do that, while you're curious, you have to have interest outside kidney disease area. And as I said also a little bit earlier, is that nephrology is a specialty which allows you to practice maybe general internal medicine at a broad scale also. But I would suggest that go out and expand the ambit of your interest even to other things like liberal arts, humanities. Unless you have the broader view of how the world works, not just health or kidneys works, will you be able to become a complete doctor? Being armed with all this knowledge, curiosity, understanding of society, understanding of science, etc., we must all include a little bit of research in everything that we do. And this research doesn't have to be necessarily, as you use the term, cutting-edge research. Just counting the number of patients, and I was walking around in the poster area, and it was interesting to see a number of things, case series, etc. So while we often put the value of these kind of research topics as perhaps lower in the food chain, but it's important. So starting by counting every day, count every day what patients you saw, just reflect on them and so on. And again, as I said a little bit earlier, is that I would advise people to be collaborative and be respectful of opinions coming from outside your own sphere of comfort, right? We should always challenge orthodoxy because orthodoxy keeps us behind, but we should do so in a respectful way. Everyone has a point of view, and it is not fair for us to be dismissive or disdainful of the other point of view. We should challenge people, and that was a question that was asked also during my talk, is what do we do about alternative systems of medicine? So even though it sounds obvious that we should discourage their use, but I think we have to do it in a respectful way which engages the practitioners of those fields. I would also suggest that don't be afraid to experiment. As I said, if you see an open door, at least try to peek through it and see what is out there. And finally, if you want to do all of this, and if you are relatively young and enthusiastic about it, I would suggest you identify a mentor, and it needs to be that mentor needs to be chosen carefully. Mentor is not someone who just gives you advice about something specific. Mentor is someone who guides you through life. A mentor is someone who you can go and talk to about anything. Doesn't have to be kidney disease. So you find such a mentor and you stick with that mentor, and grow your network of like-minded people, but also engage with people who are not like-minded. One of the worst things that is happening, especially with the social media these days, is we only talk to like-minded people, and thereby kind of continue to amplify our own prejudices. Right? I would suggest that we should be conscious of it, we should be mindful of it, and we should try to get out of it as much as possible. The last thing I would like to say is that, as I've said to my young colleagues in any possible interaction, is that I am always available. If anyone wants to get in touch with me and ask anything, I will be happy to try and answer to the extent that I can.
That's so generous of you, sir. I know how busy you are, and you have always been, and even with that, you can say that you are always available. That is really very, very generous of you, and I'm sure after this, maybe your inboxes will be full with requests for mentorship. Everyone would be lucky to have a mentor like you. But I completely agree with all your points, especially the one of teaching through every opportunity which comes across to us, and specifically also with the social media thing where we try to just augment our own thinking, and there's lots of self-praise kind of a thing going on, and that gets into a vicious cycle. So thank you so much. That was past President ISN, Dr. Jha, and his Pulse of Wisdom. Thanks a lot for joining us in this faculty interview, sir. Thank you.